Hello everyone, very good evening to one and all. Welcome back to the Vijita Rajkumar online classes. Today I am going to discuss about the bridge course second years in the subject of the zoology. Okay, so let me see the one by one. So today I would like to discuss about the 30% deleted content as well as the important questions with answers in the subject of the zoology for the who are going to write the bridge course examination and in the by PC stream. Okay, so this is the zoology. So let me see the first one is the syllabus. Actually, what are the syllabus you people may have? So bridge courses is very important and necessary for who are going to enter into the medical field. Compulsory those students have to have the bypass certificate. So vocational students you may not get the bypass certificate. If you are when you will write the bridge course examination in the bypass stream, then only you are eligible to get into the medical field. There is a reason I am requesting all the students who are have the full stuff, full capabilities, who are who are ready to do the hard work, okay, who are willing to enter into the medical field. Those students compulsory along with intervocational subjects you have to write bridge course, then only you have the ability you have the eligibility to enter into the medical field. So without the bridge course, without the bypass certificate, you don't have any right to enter into the medical fields. Clear now? So that is the reason I am telling once again. So I requesting all the students, if you have the stuff, if you have the knowledge, if you want to go into the medical field, so try to get the knowledge regarding what are the bridge course, what is the meaning, so what is the differentiation between the vocational and bridge course. Okay, I have done the one video. If you want, you can go to the previous video and all. Okay, so already you have entered in the second year, no? So that is the reason you have the little bit idea about the differentiation between the vocational and bridge course also. Okay, so that is the reason no need to worry about the okay. I didn't done the BA by PC. If I have the certificate of by PC, so I may enter into the medical field. So don't think like that. Okay, if you have the courage, if you have the interest, so please go through the bridge course material. So try to get the knowledge, try to get the awareness regarding what is the important questions will be there, what is the syllabus. So it's easy to pass, just pass marks, 10 marks for each subject. Okay, so that is the reason I'm requesting all the students, please try to focusing on the bridge course material, so definitely you will pass. So without guidance also, so whatever I'm providing the content, if you go through this video, if you go through this content what I'm providing, so definitely you will pass. Okay, I am giving assurance everybody will pass, whoever watching my channel. So once again I am welcoming all students into the bridge course classes. Okay, so let me see the one by one. This is the syllabus of the zoology for the second year bridge course second year students in the subject of the zoology. Okay, so this is the syllabus. Actually the zoology may have the 8 units. Okay, this way, so one of the units are having the two partitions, like a partition 1, partition 2, and each unit is divided into two subunits, like. Okay, so this is a unit 1. In unit 1 is the name is the human anatomy and physiology 1. So this is the two partitions will be there, like 1A 1B. So 1A is the digestion and absorption, 1B is the breathing and respiration. So here this topic is deleted. So nothing, so no need to read for the who are going to write the 70% syllabus. Those students no need to read this first unit 1A B. It's clear. So unit 1 is having two partitions. First one is the digestion and absorption, second one is the breathing and respiration. So digestion and absorption is deleted content. Okay, so next coming to the, so this is the 1B, breathing and respiration. If you go to the this syllabus only, you have to read nothing. No need to read the extra classes and all. So this is the syllabus. Up to here you can read under the unit 1B. Okay, breathing and respiration. Next coming to the unit 2, human anatomy and physiology 2. In this also two partitions will be there. So unit 2A, body fluids and circulation, excretory products and their elimination. This completely you have to read. Nothing is deleted under second units. Clear? Body fluid circulation and excreted products and their elimination, completely you have to read these units and all. Okay, you have to go through the syllabus each and every points at least. Anyhow you are reading the occasional subjects and all, isn't it? So zoology is very important, it's useful. Already we have studied in our like a, okay, like a vocational, like a by piece, sorry, MPHW, MLT, or physiotherapy, pharmacotherapy, okay, who are doing like a medical educations and all. So it's a very, the zoology subject is very easy. Why I am telling you very easy means already we have studied anatomy and physiology. That is the reason you have the little bit idea. So you may get the good knowledge, you may get the good score in zoology. Already this subject we have covered in first year in the subject of the anatomy and physiology. It's clear, na? Okay, first year's MPHW students separately, they don't have separate, but second pay motion in that separate unit will be the anatomy and physiology. In that you may cover this unit. Okay, you may cover the unit of the total zoology and subjects. Clear na? Okay. Body fluids and circulation. Second one is the excreted products and their elimination. Okay. So next coming to the third one. So the third unit is a human anatomy and physiology. Third, muscular skeletal system, and second, third B is a neural control and coordination. Okay, this is the syllabus of the third unit. Third unit is having two partitions: muscular skeletal system and neural control and coordination. Completely, you have to go through this go through this. Okay, side headings and all. At least try to write the running notes. If you don't, no need to worry, I'm not getting this material and all, so no need to get ma. So whatever I'm providing, please try to take the screenshot. If you follow this screenshot, you can make it notes with the running notes and all. Okay, no need to buy the textbooks, no need to worry about, no need to read and all other things. Whatever I'm providing, if you'll please, if you'll spend at least daily 1 hour or half an hour, it's enough. Okay, definitely you will pass. Okay, next, this is neural control and coordination. Next, fourth one is human anatomy and physiology 4. In this also two partitions will be there. Fourth A, fourth B. Endocrine system and chemical coordination. Endocrine glands, hormones and everything will be hypothalamus. Okay, like a glands. Okay. Fourth A. Next, fourth B. Immune system. Types of immunity, innate immunity, this all is easy only. Okay, fourth unit is given two partitions: endocrine system and chemical coordination, immune system. Next, fifth unit, human anatomy and physiology, human reproductive system. Human reproductive system, and second one is the reproductive health. Okay, reproductive health. Next, sixth unit is the genetics. This is a single unit. In this, there is no other subunits. Only six unit name was genetics. This is only single unit. There is no divisions of the subunits. Genetics. Next, seventh unit is the organic evolution. This unit is entirely deleted. No need to read. Okay, for who are going to write the 70% syllabus, those people no need to read for this unit. It's clear. Okay, last one is applied biology. Okay. Okay, till now I discussed about the syllabus. In that I have shown the syllabus, entire syllabus of the zoology for the bridge course second year students. Okay, I have shown the syllabus now. In that syllabus also I have explained the 30% deleted and 70% syllabus also I have shown. Next I am going to give the unit 1 and 2 notes, like important questions with answers. See here, the first human anatomy and physiology unit 1 is the digestion and absorption. Actually I told, no, what I told, this unit 1A deleted. Okay, digestion and absorption. So these are the important questions, but actually this unit is deleted, no need to read. But even though next year or other next year also, other students, they need this content, so that is it I am showing this one also. For who are going to read the 70%, those people no need to read this one. To give the dental formula of adult human beings. This question is deleted, no need to read actually, but even though we have to provide the total material for all the students, no? That is the reason I am showing. Okay. The second question. What would happen if Cl were not secreted in the stomach? Secreted by the glands present on stomach walls, it provides acidic pH, which is optimal for the action of the pepsin. Okay, pepsin plays an important role in digestion of the proteins. If HCl were not secreted in the stomach, the pepsin would not be activated. This would affect on protein digestion. Next, what is autocatalysis? Catalysis, give two examples. So next, what is chyme? Semi-fluid mass of partially digested acidic food formed in the stomach, which is called chyme. Name the different types of salivary glands of man and their locations in human body. There are three pairs of salivary glands in man. Submaxillary and sublingual glands. Next, name different types of papillae present on the tongue of man. Fungiform, filiform, circumvallate papillae. Next, what is the hardest substance in human body? Enamel of tooth is the hardest substance in the human body. Next, distinguish between diarrhea and constipation. Draw a neat table diagram of LS of a tooth. Enamel, crown, neck, foot. Describe the process of digestion of proteins in the stomach. What are the functions of liver? Okay, what are I given the digestion absorption of the first unit 1A notes. For this year students who need to read, but even though next year some of the students they need no, so that is the reason I have given this slide for those people. Okay, for who are going to read the 70% syllabus, no need to read about the unit of the digestion absorptions. Next, coming to the unit 1B, body fluids and circulation. Sorry, second unit. Okay, unit 2, body fluids and circulation. Okay, now I'm going to discuss about the unit 1B. So unit 1A, digestion and absorption, I have given important questions with answers, even though this year students no need to read. Okay, next is unit 1B, breathing and respiration. In this is a very important questions and answers in this unit. What are concave? What is meant by chloride shift? Named muscles that help in normal breathing movements. Draw a diagram of oxyhemoglobin dissociation curve. Short answers questions. Explain the process of inspiration and expiration under normal conditions. What are the major transport mechanisms for carbon dioxide? Explain. Describe disorders of respiratory system. So these are the like 1 mark questions and 4 mark questions in the unit of the breathing and respiration under the unit 1B for the bridge course secondary students in the like a BPC stream in the subject of the zoology. Okay, so let me see the important questions in this unit and answers. What are concave? So these are coat bones. It will make up the upper portion of the nasal cavity. These are different concha in the nose, such as interior concha and medial concha and superior concha. The nasal or nasal concha bones are also referred to as turbinate bones. What are concave? Concave. So these are curved bones. Concave means these are the curved bones that make up the upper portion of the nasal cavity. So these are different types of the concave in the nose. It may be interior, or it may be medial, or it may be superior. There are three types of the concave will be there in the nasal cavity. It is also termed as a turbinate bones. Okay. Next, coming to the what is meant by chloride shift. It refers to the exchange of chloride and bicarbonate ions between erythrocytes and plasma. It is also referred Burger's phenomenon. Okay, it will refers to the mainly what is meant by chloride shift. It's mainly exchange of chlorides and bicarbonate ions between the erythrocytes and plasma. So what is exchanging here? The exchange of chloride and bicarbonate ions is maybe exchange of the chloride and bicarbonate ions between the erythrocytes and plasma. It is also referred as the Hamburger's phenomenon. Next question is name the muscles that help in normal breathing movements. The muscles of the diaphragm and external intercostal muscles helps in the process of the normal breathing movements. Okay, like a sternum will be there in that moment. Intercostal muscles will be there. Muscles of the diaphragm. It will attach the muscles. Okay, that's the external outside of the intercostal muscles. These intercostal muscles helps in the process of the normal breathing movements for the human beings. Okay, next draw a diagram of oxyhemoglobin dissociation curve. Okay, so here the oxyhemoglobin saturation and next okay here the of Hg P2CO2 temperature and all this is a curve will be there. So going on raising here from here like this. Okay, temperature also see here. Okay, carbon dioxide. Okay, so this is a curve of the oxyhemoglobin dissociation curve. So next question is the so what we discuss. So I finished the 15th question. Now next coming to 16th question. In 16th question, like explain the process of the inspiration, expiration, and normal conditions. Okay, intake of atmospheric air into the lungs is called inspiration. So like a exchange of gases between the inspiration and expiration, it's known as the respiration actually. So here the inspiration is nothing but what we were inhaling the air, whatever it is present in the environment. Okay, intake of atmosphere air into the lungs is called inspiration. It is an active process as it takes place by the contraction of the muscles of the diaphragm and the external intercostal muscles which extend in between the ribs. The contraction of the diaphragm increases the volume of thoracic chamber in the anterior posterior axis. The contraction of the external intercostal muscles lifts up the ribs and sternum, causing an increase in the dorsal-ventral axis. The overall increase in the thoracic volume causes a similar increase in the pulmonary volume. Okay, an increase in the pulmonary volume decreases the intrapulmonary pressure to less than the atmosphere, which forces the air from the outside to move into the lungs. That is inspiration. Okay. So we are inhaling the what is the air will presence in the environment, that is we are inhaling, that is known as the inspiration. Okay, so next coming to the just generally you have to think and you have to write. Next expiration. Expiration is nothing but whatever you are releasing from the lungs to the outer world. Okay, release of alveolar air to the exterior is called expiration. It is a passive process. Relaxation of the diaphragm and external internal costal muscles returns the diaphragm and sternum to their normal positions and reduce the thoracic volume. We are inhaling, we are exhaling. Okay, okay, we are releasing, no, that is the reason we are reducing. When you are inhaling, we are increasing our intercostal muscles. Automatically we are raising the okay pressure. So here we are anyhow we are releasing nose, that is the reason relaxation of the diaphragm and external intercostal muscles returns the diaphragm. So that is the reason that the thoracic reduces the thoracic volume, thereby the pulmonary volume. It leads to an increase in the intrapulmonary pressure to slightly above that of the atmospheric pressure, causing the expulsion of the air from the lungs. It is called yes. So mainly you no need, if you are not understanding means easily you can write this, a release of air to the exterior is called respiration. Otherwise, one more mean expulsion of air from the lungs. Expulsion of the air from the lungs, it is known as the expiration. Next, coming to the, what are the major transport mechanisms for carbon dioxide? Explain. Okay, in dissolved state and carb carb carbamino compounds. Okay, these are mechanisms of the carbon dioxide. Okay, dissolved state. So this is the formulas will be there. As bicarbonates, just to generally you have to write, otherwise you have by heart this formula CO2 plus H2 plus to H2 CO2 and again HCO. It's again formed has like a CO3 and H plus. Okay. Next, describe disorders of the respiratory system. This is also very important question. This also the respiratory system. Asthma. Asthma is nothing but difficulty in breathing caused due to the inflammation of bronchi, bronchioles. Symptoms include coughing, difficulty in breathing, and wheezing. Okay. Next, emphysema. Emphysema is nothing. It's a chronic disease. It's not a sudden attack. It's a long. It's caused by the different version, but even the patient may not having this sudden type of pain. It's a chronic long time. Okay, it's a chronic disorder in which alveolar walls are damaged and the air walls collapse, due to which respiratory surface area of exchange of gases is decreased. One of the major causes of this is smoking of tobacco, emphysema. It's a chronic disorder. It mainly affects the alveolar walls of the lungs and damage and their walls due to the which respiratory surface area of exchange of gases is decreased. Okay. So the main cause of this problem is the smoking of tobacco. Next comes bronchitis. Bronchitis is nothing but inflammation of the bronchioles or bronchi. So what will happen if the inflammation will takes place in the bronchi of the lungs? It will be result in the swelling of the muscles. So swelling of the mucus lining of the bronchi. So automatically it will increase in the mucus production and decrease in the diameter of bronchi. Symptoms include chronic cough with thick sputum. So due to the inflammation of the bronchi, it may be resulting in the swelling of the mucus lining of the bronchi. Automatically increasing the production of the mucus, and automatically when the production will be increased, automatically the decrease in the chamber of the bronchi is decreasing. So the patient may have the symptoms of chronic cough with thick sputum. Next comes the pneumonia. Pneumonia is mainly one of the infection caused by the Streptococcus pneumonia and also be certain virus, fungal protozoans and mycoplasms of the lungs. Okay, it's a mainly one of the infection caused at the lungs, mainly caused by the streptococcal pneumonia, and also different categories of the viruses, fungal protozoans, infections and mycoplasms. The main symptoms include inflammation of lungs. Inflammation of the lungs, accumulation of the mucus in the alveoli, and impaired exchange of gases, leading to death if untreated. If the patient have the like a cough or anything, immediately we have to go for the hospital for confirmation of the diagnosis, and based on that we will take the treatment. We may not have the problem of severe. Okay, here what will happen? The pneumonia is nothing but the mainly accumulation of the mucus in the alveoli will takes place. Accumulation of the mucus will be takes place in alveoli. It will happen the like a mucus will be there in the presence of the alveoli. So there is a chances of impairment of exchange of gases in between the in the lungs. So finally it leads to death if the patient is not treated by the treatment. Next, occupational disorders. So these are caused by the exposure of the body to the harmful substances, asbestos, silicosis, cirrhosis, black lung disease. Okay, asbestos is nothing but it's occurred due to the chronic exposure to the asbestos dust to the people working in the asbestos industry. Okay, it's a occupational disease, nothing but the who were working as a employee in the particular industries related to the asbestos companies and all. Okay, that is the reason automatically they are inhaling these asbestos. So exposure of dust particles is exposure to asbestos dust in the people working in the asbestos companies and industries. Next one is the silicosis. It is also same occurs people long term exposure to silica dust. It will interact into the lungs of the bronchioles, alveoli and all. That is the reason patient may suffer with the chronic disease and okay, like acidosis. It occurs due to the deposition of the iron particles in tissue. Siderosin, siderosis, accumulation, deposition of iron particles and dust. Next, black lung disease develops from inhalation of coal dust. Okay, inhalation of coal dust. So these are the some of the okay respiratory disorders. So till now I completed about the unit 1A, unit 1B, like digestion and absorption is deleted topic, entirely this unit, even I have provided. Next unit 2, like okay, unit A is the breathing and respiration. It's clear na breathing and respiration. This unit 1B. I finished the one. I have discussed the syllabus in the zoology for the bridge course secondary students, as well as the I have given important questions with answers in the unit 1A, unit 1B. Okay. So next day I will come with the next unit in the zoology for the bridge course secondary students. Until then, okay, watch my channel. So thanks for watching my channel. Have a nice day.